Welcome to our senior health video, which will talk about potential symptoms of pancreatic cancer that you may have overlooked. Have you ever wondered why some of the deadliest diseases arrive without a sound? Why so many people feel fine one day and face a life-changing diagnosis the next? It's one of the greatest medical mysteries of our time, and pancreatic cancer is its most silent killer. This disease often develops quietly without dramatic symptoms until it's already advanced. By the time most people notice something is wrong, the window for early treatment has already begun to close. According to the World Health Organization, hundreds of thousands lose their lives to it every year, many without ever realizing the danger growing inside them. What makes it so terrifying is how ordinary its early signs can seem. A little stomach discomfort, fatigue, a few pounds loss. These are the kinds of changes anyone might dismiss. Yet for some, they're the first whispers of pancreatic cancer. The pancreas sits hidden deep in the abdomen, quietly managing digestion and blood sugar. When something goes wrong there, the signals are subtle until they're not. And once symptoms become obvious, the disease has often spread beyond control. But here's the good news. Modern research has uncovered 15 early warning signs that can help detect this cancer before it becomes deadly. They are real science-based clues that can save lives when recognized in time. In this video, you'll learn what to look for, how these symptoms appear, and what steps can lead to earlier diagnosis. This isn't about fear, it's about empowerment, awareness, and hope. The knowledge you gain today could protect you or someone you love tomorrow. So stay with us until the end, because understanding these signs may truly be the difference between life and loss. Number 1, abdominal pain. The deep ache that should never be ignored. It often begins with something small, a dull ache in your upper abdomen that creeps toward your back. You assume it's gas, stress, or a pulled muscle. But when that pain becomes a regular visitor, especially after meals or while lying down, it deserves attention. Persistent upper abdominal pain that radiates to the back is one of the earliest warning signs of pancreatic cancer. The pancreas sits deep inside your abdomen, surrounded by major nerves and organs. When a tumor starts growing, it presses on those nerves, creating a deep, constant pain that may ease only when you lean forward. A study in the Journal of Gastrointestinal Surgery found that patients with pancreatic tumors pressing on nerve fibers experienced severe abdominal pain and had shorter survival times than those without pain. That means this discomfort is not random. It's your body's signal that something serious may be happening beneath the surface. If you notice this type of pain lasting more than a few days, don't mask it with painkillers. Track when it appears and seek medical advice quickly. One woman from Ohio thought her backache came from gardening until doctors discovered an early pancreatic tumor. Surgery saved her life. But pain is only the first whisper. The next sign comes quietly when your hunger fades away for no reason. Number 2, loss of appetite. When food suddenly stops appealing to you, it sneaks up quietly. Meals you once loved no longer sound good, and even the smell of food makes you feel uneasy. You think it's stress or aging, but when your appetite fades for no clear reason, your body may be warning you. A sudden and lasting loss of appetite can be one of the earliest signs of pancreatic cancer. The pancreas is vital for digestion. It releases enzymes that help your body absorb nutrients. When a tumor disrupts this process, your system begins to malfunction, and your brain receives false signals that you're full even after eating very little. Over time, this leads to weight loss, weakness, and malnutrition. A 2019 study published in The Oncologist found that more than 80% of pancreatic cancer patients experience appetite loss connected to enzyme disruption and inflammation. This is not simply skipping meals, it's your body being misled from within. If food starts losing its taste or you feel full unusually fast, don't ignore it. Track the pattern and ask your doctor for digestive tests or imaging. A retired teacher from California thought her fading appetite was just part of aging. Testing showed a small pancreatic growth caught in time for surgery. But loss of appetite is only the beginning. The next symptom builds quietly and feels like nothing more than a bloated stomach until it becomes something far more serious. Number 3, bloating, the fullness that refuses to leave. It starts with something small. You eat a normal meal, but instead of feeling satisfied, your stomach feels tight and heavy for hours. You blame it on overeating or gas, but when the bloating keeps returning day after day, it may be more than digestion. Persistent bloating that lingers or worsens over time can be an early sign of pancreatic cancer. The pancreas produces enzymes that help your stomach break down food. When it stops doing that effectively, food stays in the stomach longer than it should. This delayed digestion causes pressure gas buildup and that uncomfortable swollen feeling that doesn't fade with antacids or home remedies. A large study in the San Francisco Bay Area revealed that people with pancreatic cancer were 20 times more likely to report unexplained bloating compared to healthy individuals. That kind of difference is no accident. It's a scientific clue. If you experience ongoing bloating without clear cause, don't ignore it. Track when it happens and mention it to your doctor. Sometimes a simple enzyme test or abdominal ultrasound can catch early pancreatic issues before they become dangerous. A man from Florida said he lived with constant bloating for months until tests revealed a small tumor pressing on his pancreas. Treatment came just in time, but bloating is only one piece of the puzzle. The next warning hides behind a common symptom most people treat with antacids: indigestion. Number 4. Indigestion. You finish dinner and feel that familiar pressure rising in your chest. Maybe it's heartburn, you think, or eating too late. But when that uneasy burn keeps coming back, no matter what you eat or how healthy your diet is, it could be your body trying to tell you something important. Persistent indigestion that doesn't improve with medication can be an early sign of pancreatic cancer. The pancreas helps your stomach release enzymes that digest food smoothly. When it stops working properly because of a tumor, digestion slows down. Food remains in your stomach longer, leading to bloating, nausea, or a burning sensation after meals. What feels like simple acid reflux might actually be pressure caused by a growing mass pressing against your stomach or small intestine. In a BMJ open study, researchers discovered that people suffering from frequent indigestion without typical heartburn had nearly 4 times the risk of pancreatic cancer. That is not coincidence. It is a red flag. If your indigestion refuses to go away, even after changing your diet, pay attention. Record your symptoms and see a doctor for digestive testing or imaging. One man from Texas thought his constant bloating was from spicy food until scans revealed an early pancreatic tumor. Quick treatment gave him a full recovery. But indigestion is just one clue. Sometimes the next sign isn't a burning feeling, it's a sudden rush to the bathroom that won't stop. Number 5, diarrhea. It might seem harmless at first. A few days of loose stools may be something you ate. But when diarrhea keeps returning without reason, your body could be warning you about something far more serious. Persistent watery or oily stools are one of the most overlooked early signs of pancreatic trouble. The pancreas releases enzymes that help your body digest fats and nutrients. When cancer blocks those enzymes, food passes through too quickly, leaving your system unable to absorb what it needs. The result is frequent urgent trips to the bathroom and constant fatigue from hidden malnutrition. A report from the American Journal of Gastroenterology described a case where continuous diarrhea was the only clue leading to a pancreatic cancer diagnosis. No pain, no jaundice, just digestion out of control. If this sounds familiar, don't ignore it. Stay hydrated, watch for recurring patterns, and ask your doctor about enzyme or imaging tests. One Chicago man thought his symptoms were from stress until scans revealed a small tumor pressing on his pancreatic duct. Early detection saved his life. But just knowing this isn't enough, because the next warning also hides in your stool, and it looks deceptively harmless. It's the appearance of fatty stools that refuse to flush away. Number 6, fatty stools. You might notice it one morning and think nothing of it. Your stool looks pale, shiny, or floating, leaving an oily film in the toilet. But that simple detail can reveal something your body has been struggling with silently. Fatty or greasy stools are a clear sign that your pancreas is not producing enough digestive enzymes to break down fat. When those enzymes are blocked by a tumor, unabsorbed fat passes straight through your system. This not only changes the look of your stool, but also steals the nutrients your body desperately needs. Doctors call this condition steatorrhea, and research shows it appears when more than 90% of pancreatic function is lost. If you notice persistent oily stools, don't dismiss it as diet or age. Consult a doctor and request enzyme level testing or imaging. One woman from Seattle shared that noticing this small but strange change led to an early diagnosis and successful surgery. But paying attention to stool changes alone won't protect you completely because the next symptom can feel entirely different. It's constipation, and it hides behind a sense of normalcy that often delays discovery. Number 7, constipation. Everyone experiences it occasionally, but when constipation becomes your new routine, it can signal something far more serious than just poor diet. Persistent constipation that lasts for weeks or keeps coming back may point to disrupted digestion caused by pancreatic dysfunction. When the pancreas struggles, food moves more slowly through your intestines, causing hard, dry stools that are painful to pass. The longer this slowdown continues, the more toxins and waste linger inside the body, creating bloating, discomfort, and fatigue. In some cases, the cause is not only digestive, but structural, as a pancreatic tumor can press on nearby organs and restrict movement within the gut. Scientific evidence supports this concern. A recent Frontiers in Oncology study found a direct link between chronic constipation and a higher risk of developing pancreatic cancer, showing that constipation might not just be a symptom, but also a contributing factor. Ignoring it gives the disease time to advance quietly. If you find yourself relying on laxatives often or feeling that your system no longer works like it used to, it's time to act. Drink more water, increase fiber intake, stay active, and consult a doctor for evaluation. One woman from Denver thought her constipation was just menopause-related. Tests revealed early pancreatic changes that were caught just in time. But constipation is only one part of the story, because what happens next affects not your digestion, but your muscles. And that's where the danger becomes visible. Number 8, muscle wasting. You look in the mirror one day and notice your arms or legs seem thinner. You haven't been dieting yet. Your clothes fit loosely, and climbing stairs suddenly feels harder. Unexplained muscle loss, known as muscle wasting, can be one of the earliest signs that pancreatic cancer is affecting your metabolism long before diagnosis. It doesn't happen overnight. The body slowly starts breaking down muscle tissue to use for energy because it can no longer properly process nutrients. When tumors interfere with digestion and hormone balance, your body shifts into a state of hidden starvation. A study published in Nature Communications found that this loss of muscle could appear up to 18 months before pancreatic cancer is discovered. That means your body often knows long before tests do. Patients with this symptom frequently describe a feeling of weakness that no amount of rest can fix. It's not just weight loss, it's your strength fading away. If you notice your muscles shrinking despite eating well, take it seriously. Ask for a metabolic check or pancreatic screening. Early detection allows doctors to restore nutritional balance before the disease progresses. A man from Arizona said his arms felt smaller, even though he was eating more. His decision to get tested revealed pancreatic cancer in its earliest stage. But muscle loss is not the last warning. The next clue begins to show on your skin, and it's one you can see every day. Number 9, pale or grayish skin. Sometimes the first warning sign is not pain, but reflection. You catch your image in the mirror and realize your skin looks different. Duller, maybe slightly yellow or gray. Friends might comment that you look tired, but this subtle shift can mean something deeper. A pale or grayish skin tone often signals a buildup of bilirubin in the blood, a condition that happens when the bile duct becomes blocked by a pancreatic tumor. When bile cannot flow properly, it seeps into the bloodstream, tinting the skin and even the whites of your eyes. This is one of the most visible early signs of pancreatic distress. Research in clinical gastroenterology and hepatology found that jaundice and bile obstruction were among the first symptoms reported by patients later diagnosed with pancreatic cancer, especially when the tumor developed near the head of the pancreas. That location makes it easier for the mass to press on the bile duct and alter your skin's natural color. If you notice your skin turning yellow-gray or unusually pale, don't wait for it to fade on its own. Schedule blood tests or imaging immediately. One woman from North Carolina thought her skin change came from vitamin deficiency. Testing revealed an early tumor blocking her bile duct, caught just in time for removal. But this visible sign is only the surface. The next clue hides within your blood sugar, quietly rewriting the body's chemistry before anyone realizes. Number 10, sudden onset diabetes. It can appear out of nowhere. You visit your doctor for fatigue or thirst, and suddenly you are told you have diabetes. You wonder how it happened. especially if you've never struggled with blood sugar before. For adults over 50, the sudden onset of diabetes can sometimes be an early sign of pancreatic cancer. The pancreas is responsible for producing insulin, the hormone that regulates glucose. When a tumor begins to form, it can disrupt that delicate process, leading to unstable blood sugar levels and unexplained changes in weight or energy. Your pancreas may be sending an early distress signal through your metabolism. Studies show that about 25% of pancreatic cancer patients were diagnosed with diabetes within 3 years before their cancer was discovered. Researchers believe the tumor interferes with insulin production long before any other symptom appears. This means that for some, diabetes is not the cause, but the first consequence of the disease itself. If you are newly diagnosed with diabetes after 50 and also experience weight loss, fatigue, or digestive issues, ask your doctor about a pancreatic check. Simple imaging or enzyme tests can rule out hidden problems. A retired nurse from Oregon thought her new diabetes was stress-related. Months later, scans revealed a small pancreatic growth removed before spreading. But the story doesn't end here. Sometimes the danger doesn't appear in sugar levels at all, but in something far more sudden: blood clots forming without warning. Number 11, blood clots. It often begins with something that feels unrelated: a sudden swelling in your leg, warmth in your arm, or an ache that refuses to fade. You might think it's a muscle pull or poor circulation. But when blood clots appear without a clear reason, your body could be revealing a serious hidden threat. Unexplained blood clots, especially those that migrate or reappear, can be one of the earliest signs of pancreatic cancer. This happens because the disease creates a state doctors call hypercoagulability, meaning your blood becomes thicker and more likely to clot. A 2024 study in Cancer Medicine found that over 4% of patients develop venous thromboembolism within a year before their pancreatic cancer diagnosis. These clots can appear in unusual places such as the arms or chest wall, a condition known as Trousseau's syndrome. What makes this so dangerous is that the clot often shows up long before any digestive symptoms do. If you ever develop swelling, redness, or sudden pain in a limb, don't ignore it. Seek medical help and ask for blood tests and imaging. One man from New York discovered his clot wasn't from sitting too long, but from an early pancreatic tumor. That early clue gave him time to act. But this warning from your blood isn't the only one your body gives. Sometimes the next signal comes from your skin again, not in color this time, but in a relentless, unexplained itch. Number 12, itchy skin. At first it feels like a small irritation, a patch on your arm or your back that itches no matter how much you scratch. You try lotions, change soaps, even blame the weather. But when the itching keeps returning and nothing seems to help, it may not be your skin at all. Chronic itching can be an early warning sign of pancreatic cancer caused by bile building up under the skin. When a tumor blocks the bile ducts, substances like bile salts and bilirubin start to accumulate in the body. These chemicals irritate nerve endings, producing a deep, persistent itch that no cream can calm. Scientists have found that the enzyme autotaxin increases a compound called lysophosphatidic acid, which triggers itch-specific nerves, meaning the problem starts inside, not outside. This type of itching often appears on the hands, feet, or legs, and can be worse at night. If you notice long-lasting itching without rash or allergy, it's time to dig deeper. Ask your doctor for liver and bile duct tests to rule out pancreatic obstruction. One woman from Nevada said she almost ignored her stubborn itch until her skin turned slightly yellow. Tests revealed early bile duct blockage caused by a small tumor. She caught it before it spread. But itching is just one part of the body's reaction. Sometimes the next clue is not felt on the skin, but seen in a thermometer that never seems to cool down. Number 13, fever. A mild fever might seem harmless, the kind you brush off with rest and water. But when it lingers for days or keeps returning without infection, it can be your immune system signaling something serious. Persistent low-grade fever is sometimes one of the earliest and most overlooked signs of pancreatic cancer. Unlike typical fevers caused by viruses or bacteria, this one happens because the body is reacting to inflammation triggered by tumor growth. Doctors call it neoplastic fever, a fever caused not by germs but by cancer itself. In one documented case, a man with pancreatic adenocarcinoma experienced continuous fever as his only symptom. After his tumor was removed, the fever disappeared within days, proving the direct connection between the two. A large-scale Danish study also found that unexplained fevers often appeared in the 5 years leading up to a pancreatic cancer diagnosis. If you find yourself running a temperature that refuses to break, don't dismiss it as stress or fatigue. Keep track of its pattern and duration, and consult a physician if it persists. A retired engineer from Florida thought his mild fever was from overwork. Further testing revealed early pancreatic inflammation that could have turned deadly if ignored. But fever is not the final warning. The next clue is exhaustion so deep that even sleep cannot fix it. Number 14, fatigue. This isn't the usual tiredness after a long day. It's a heavy sinking fatigue that clings to you from morning to night. No amount of rest or coffee seems to bring your energy back. Constant, unexplained fatigue is one of the most common and disabling symptoms of pancreatic cancer. It happens because your body is fighting a hidden battle draining energy to combat inflammation, anemia, and the chemical changes triggered by tumor growth. The pancreas affects not only digestion, but also how your body converts food into usable energy, and when it fails, exhaustion becomes inevitable. A study from an oncology center in northern Italy found that more than 90% of pancreatic cancer patients experience this type of unrelenting fatigue, especially older adults and women. They described it as a feeling of heaviness, both physical and emotional, that made even simple tasks difficult. If you feel chronically drained despite good sleep and nutrition, pay attention. Ask your doctor for a full blood count, check your iron and enzyme levels, and monitor any weight loss or changes in digestion. A man from California said his fatigue was so strong, he stopped his morning walks. Testing revealed early pancreatic inflammation. Treatment restored his strength and his hope. But fatigue doesn't stand alone. It often blends with one final signal, a quiet, vague sense that something inside just isn't right. Number 15, general malaise. It begins subtly. You wake up feeling off, not exactly sick, but not yourself either. You lose motivation, your energy feels drained, and even small routines seem heavier than before. This vague sense of unwellness, known as malaise, can be one of the most overlooked early signs of pancreatic cancer. It doesn't scream for attention, yet it quietly whispers that something deep inside is out of balance. When your pancreas starts to fail, your body releases inflammatory chemicals that affect mood, energy, and overall well-being, creating a persistent feeling of fatigue and unease. A large Danish study examining more than 25,000 cases found that general malaise and exhaustion were among the most frequently recorded symptoms in the months before diagnosis. Another study in the United Kingdom showed that patients who reported this just not feeling right sensation were more than twice as likely to later be diagnosed with pancreatic cancer. If you feel this way for weeks without explanation, don't brush it off. Request medical evaluation, especially if it comes with weight loss, digestive issues, or new fatigue. One woman from Ohio said she almost ignored her constant tiredness and low mood until tests revealed a small pancreatic tumor. Acting early saved her life. But even as these warnings add up, one truth remains clear. Knowledge and early action can transform fear into survival, and that power begins with awareness. You've just learned the 15 silent signs your body may use to warn you long before pancreatic cancer takes control. Now take a deep breath and remember this truth. Knowledge is power and awareness is protection. Every single habit you change today, every small step toward early detection, can transform fear into strength and prevention into peace. If you have noticed any of these symptoms, don't panic, but don't ignore them either. Talk with your doctor, ask questions, and request the right tests. Your health deserves time and attention. Eat balanced meals rich in fruits and vegetables, stay hydrated, and keep your body moving every day. A few simple choices can reduce inflammation, improve digestion, and support your pancreas naturally. Your body is stronger and more resilient than you think. Remember, it's never too late to start caring for yourself. Early awareness saves lives. So keep learning, stay curious, and never stop listening to what your body's trying to tell you. In our next video, we'll explore the best foods and daily habits that help protect your digestive system and keep your energy strong as you age. Before you go, save this video so you can re-watch it anytime, and subscribe to our channel for the latest science-based tips on senior health and nutrition. We share weekly updates, new medical insights, and easy home strategies to keep you healthy, active, and independent for years to come. Your journey to better health starts now, and we're here to guide you every step of the way.